Hello and welcome friends. Today we will be talking about the one of the another type of injury, that is thermal injury. And in thermal injury generally we think that it is only burn, but injuries are due to heat can be both are of both extremes, like injury due to high temperature also and injury due to low temperature also. So we will be discussing mainly today the injury due to low temperature. Before that, going into that, we will be going to the general concept of thermal injury and general physiology through by which we can understand the how the thermal injuries occur, and we should be aware that we can, if we avoid the circumstances, the chances are that less thermal injuries can happen. Let's take a look over it. Thermal deaths. Basically, forensic deals with the injury and death only. So, thermal deaths are those that result from the systemic and localized exposure to the excessive heat or cold. Heat or cold both. It's not only heat. We generally think there is a heat also, but there are in colder areas or in cold places there are cold injuries also. That means exposure to the extreme cold condition, extreme weather conditions, then can lead to different scenarios of cold or hot, and we will be going through it in a different manners. The main factor determining the deleterious effect of the heat are the temperature, the intensity of heat applied, and the duration for which it means the intensity of the temperature difference, body temperature difference, either it is a high temperature or it is a low temperature. It is the intensity or the difference in the body temperature and the surrounding, and the duration for which it is applied. In it results into the heat injuries. Systemic hyperthermia, it is another condition like which is systemic. It means it is not localized to one place. Systemic means it is all over, all in the body, all over in the body, and the normal body temperature is maintained by thermoregulatory center of the hypothalamus. Hypothalamus is a center in the brain that regulates the heat. If this is impaired, hypothalamus is impaired, though there are chances as person may feel extreme cold, may feel extreme hot, hyperpyrexia, depending upon the thalamic condition. So hypothalamus is almost intact, and its input method and its output method regulates the body temperature. Despite environmental variations because of the thermoregulatory center balance, excess heat production derived from the metabolic activities in the muscle and liver. So, excessive metabolic activities like excessive secretion of the glucose or the glucagons or the muscle activity, these all produce more heat with the heat dissipation from skin and the lung. And when there is a excessive heat, then heat loss takes from the skin and the lungs. Lungs is basically one of the constant source of the heat discharge. That is, if air goes inside the lung, it instantly get hot and it exchanges with the lung surface. It takes heat from the lung surface and comes out. So lungs and skins are the constant source of heat discharge, and the muscle activity and the liver activity are constant source of heat production. So these two factors will always be defining the body temperatures, hypothermia, hyperthermia. These two factors are mainly mainly deciding in these two conditions. In between there is a dry burn and all that we will be classifying, that are the different scenarios, but the generalized decrease in temperature or increase in temperature is controlled by the hypothalamus, and later by muscular activity or the liver activity, or later by the skin or the lung activities. So endogenous febrile means it is within the body due to some the factors within the body which are causing the febrile hyperthermia, means there is increase in the temperature within the body, means the system is system within the body, not any external factor is involved. It implies an elevation of the body temperature that exceeds the normal daily variation and occurs in conjunction with the hypothalamic set point. The hypothalamic set point then means there is a, in hypothalamus there is a constant point that keeps the body temperature is around 37.1 degree centigrade, which is a average. It may be 36 to 37.5, but the average comes to around 37.1 degree centigrade. So hypothalamic set point is around this. Anything above it or anything below it is considered to be hyperthermia or hypothermia. When the temperature goes above or below this point, drastic changes occur in the rates of heat loss or heat production or body temperature reapproaches to. So if there is any variation in this, then there is a heat loss, then the body temperature will come to the normal, or there is a heat production, then the body temperature comes to the normal. So hypothalamus regulates the body temperature by these two mechanisms, and in heat loss we find the skin and the lungs, and the production we find liver and the muscles. Exogenous non-febrile, it means some external factors are causing raise in the body temperature. Some external factors means environmental factors. That environmental factor can be heat wave, excessive work, or some heat stroke, or something external application of the heat, like hot waves, like hot conditions, person is working in hot environment, or sometimes excessive heat can lead to muscle cramps. These are the external factors. So we can be describing according to that. Implies an unchanged setting of thermoregulatory center in conjunction with an uncontrolled increase in the body temperature that exceeds the body's ability to lose heat. Depending on the progressive order of the severity, excessive heat may be divided into effects of excessive heat may be divided into heat cramps, heat exhaustion, or heat stroke. So these are the conditions that can be described in detail in the later lectures. So this is basic outline of the hyperthermia that may be exogenously applied and that can affect the body. If we go to the categorization of or classification of the thermal injuries, there are basically two types of injuries due to exposure to the cold or heat, means raise in the temperature. That is exposure to means that is around body temperature is 37.1 degree or 37 degree centigrade. Then anything below that is cold, anything above that is hot. Cold can be generally of two types, that we have general effect hypothermia. We will be discussing this today only, hypothermia, and the local effects. Local effect means the low temperature is exposed to certain parts of the body. So if certain part of the body is affected, then we have frostbite in the legs and somewhere else, trench foot mainly in the foot, immersion foot generally in the foot, heat stroke, then we have heat. In heat we can have general effect. Then the general effect can be of heat stroke, that we have already discussed, heat exhaustion that is we have already discussed, and heat cramps generally happens in the high and humid condition, high heat and humid condition, the cramps of the muscles happen. And the local effect, which is more discussed and more common in our scenario, in our setup, or in our mortuary, that person dies with the burn. So local effect of the heat is dry burn, that is generally due to burning of the cloth, burning in the other artifacts in the surrounding. And dry burn is the maximum, most of the common cause of the death in our setups, because most of the person with dry burn, they land up in the emergency, or they land up directly in the mortuary. Apart from that, there is another type of burn, localized burn, is due to hot liquid. Hot liquid can be hot water, hot oil, milk, and any other hot metals. These are the hot liquid which are generally in the scenarios, and generally mostly in the industrial aspect, or in the children's, where they are exposed to the hot liquids. So these scenarios, different scenarios are there. But in our setup, generally we have dry burns, or in India we have very much common crime, or we can say common social aspect also, that is a dowry death, in which mostly the brides are being burned. So we deal with that a lot of cases, and we do postmortem, and we have different laws for that. Dry burn, or burn, or the married women dying within the 7 years of a marriage and due to burn. So we have laws for that, separate laws. We will be discussing each aspect separately, and we will be going through a lot of elaborations and a lot of thinking in that. Hypothermia first we will take today. Hypothermia, as in the case of heat, cold may affect the body in two ways. Jaise it means the heat effect, cold also affect the body generally two ways. One is the general effect, another is the local effect. General effect is mostly common in the western countries, where there is almost throughout the year there is a cold weather condition, and where in our setup, we don't have the hypothermia unless until we are living in the mountain areas. We have overall temperature very low. So though the generalized effect caused by lowering of body temperature as a whole, or through local effect of the cold producing lesions or the extremities such as frostbite or immersion food, that I have already described, is that it is a localized phenomena, whereas generalized phenomena is overall decrease in the body temperature. So hypothermia, further we can say that the temperature of the peripheral part of the body may vary depending upon the environmental and other factors. Central or the core body temperature is constant, but body means that thermoregulatory center tries to make the central body temperature constant, but it may be varying also. Body try to maintain the main central body like brain, heart, and other central body temperatures to be constant around variation of 1.5 degree Fahrenheit temperature. The internal temperature of body is regulated by heat production or heat loss by mechanism that I have already discussed. The former, though metabolic control by thyroid hormone or muscular. Thyroid hormone is also playing a role through the hypothalamus and the hormone and the muscular activity. These means overall hypothermia or hyperthermia depends upon the production of the heat and the loss of the heat. By increasing blood flow through the skin or by sweating, it means we can lose the heat also by sweating or the increasing blood flow. Sweating, it means when the sweat is there, it will evaporate and take the heat from the skin. So skin will ultimately be cooled down. Central receptor usually considered to be situated in the hypothalamic region of the brain, also near the carotid sinus, regulate the body temperature. Central receptor, these are the receptors in the brain and the carotid sinus that regulates the body temperature. Skin and lung are the two most affected systems of the body. Skin and lungs are basically the two most important organs that help in losing the body temperature. Like skin is totally exposure to the environment and lung is exposure to the air which we inspire or expire. The cold and temperature of the atmosphere result in the loss of body heat from skin surface as well as the lung also. Hypothermia local effect could upon the tissue may result from the various factors like vasoconstrictions. Means if there is a heat, there is a suddenly low temperature or constant low temperature, then the following phenomena is happening in the body, that is vasoconstriction, which is usually a protective mechanism to maintain the body temperature, injury to the small blood vessels with the formation of agglutinative thrombi in them caused by stagnation of blood vessel. An additional factor may be subsequent overheating, which elevates the metabolic beyond the level that the damage blood supply can. If suppose we are exposed to the cold condition, then suddenly we go for the extreme hot condition, then in that condition there are chances that there is damage to the blood supply. So generally there is a vasoconstriction there, then it decreases the skin blood supply, tries to conserve the central body temperature, but in these constrictions can lead to injuries also because of the thrombi also, forming thrombus also at the point at the skin surface and the blood vessels there, and it can be also lead to damage due to overheating suddenly from the cold. So we should be varying and we should be thinking about how we will be talking in the later slide that how we can subsequently treat a person who is being subjected to the cold conditions. Hypothermia is basically hypo is equal to less plus thermia. Less temperature is defined as having core body temperature less than 95 degrees centigrade or 35 degrees centigrade. It means certainly it is below 35 degrees of Celsius, then it is called hypothermia. Normal is 36 to 37.5 degrees centigrade, and hypothermia is something which is less than 35 degrees centigrade. If the temperature further falls, then the chances are different features of hypothermia will develop, which is generalized, and we will be seeing in the different slides coming that different features of hypothermia will develop. Body will react to the low temperature, certain receptors will activate, hypothalamus is activated and it will lead to different reactions to conserve the central body temperature and try to remain alive. So as far as the various factors are concerned, individual factors that may help or may subject person to the cold condition or subject person to hypothermia is inadequate clothing, that is most important. Sheltering, we see that in our centers, in our local areas, government developed the night shelters with the arrangement of wood fire and all that to keep the people warm. We distribute very different types of blankets and all that for covering the body. Lean and low body fat is also a cause of hypothermia. Advanced age, people may not take care of themselves. Young children, especially these are those who are newborns, they are very much subjected to heat loss and they can develop hypothermia. Black men and women develop more hypothermia as compared to white men and women because it is a somehow related to their economic, socio-economic condition in Europe and America. Healthy health conditions, sometimes burn itself, dry burn is itself is the cause of hypothermia. It means dry burn exposes the skin and that leads to increased uh, loss of the water, and that increased loss of water can lead to the numbness or low temperature of the skin. Diabetes can lead to decreased sensitivity of the skin, then can lead to hypothermia. Glycemia can cause um, hypothermia. Neurological lesions in the hypothalamus can disturb the equilibrium. Dementia, that is another. Forgetfulness means can person be not be aware with the surrounding temperature, may not be aware of the wearing clothes, and may not be aware of the other factors. Hypoadrenalism is a disease. Hypothyroidism, hypopituitarism, these are the hormonal linked glands that somehow connected with the regulation of the body temperature. Raynaud's phenomena, this is the disease of the blood vessels which when happens constrict and leads to the decreased supply of the blood to the skin. So hypothermia may develop. Trauma, increased blood loss can lead to hypothermia. Spinal cord injuries, complete transaction of the spinal cord can lead to complete irregulation of the body temperature below that, and that can cause hypothermia. So there are the various health condition also can lead to hypothermia or hypothermic injuries or hypothermic conditions that can also lead to death also. Medication, some of the medicines also cause hypothermia, one of which is alcohol. Alcohol we generally not in our countries, in our regions, but in the colder countries people generally drink alcohol to warm themselves because alcohol increases the peripheral skin vascular supply, blood supply. But a person is already in hypothermia, he should avoid alcohol because if the central blood is sent to the periphery, then the central blood temperature, body temperature will go down and the hypothermia will further worsen. Anesthetics, some of the anesthetics can lead to disturbances in the brain centers. Antidepressant can lead to hypothermia. It disturbs the glands. Antithyroid agent can disturb also. Sedative and narcotics, these are all mild hypothermic drugs, but not very high, but in strong doses it can affect also. So we should be aware in taking history. We should be aware with the surroundings. We should be aware with the some of the drugs very prevalent in the society, or we should be aware with the current case scenarios in the society, so that we should know which type of cases are coming to us, which type of cases are not coming to us, in which conditions the patient may end up in such conditions. So we should be very much aware of the society. As a doctor or as a clinician or as a forensic medicine expert, we should be very much thorough to the social habits there, social conditions, the people around us, so that we can analyze their conditions and we should anticipate any injury or any condition which may present to us. Environmental factors, extreme cold condition or chill condition or the breeze condition. High air motion means there is somewhere where there is long gallery or long road, long something there is a movement of air. These can take much of the heat from the body. Rain condition and immersion in the cold water, in skin contact, constant contact with the metals or the fuels that may take their heat. Repeated cold exposure, sometimes very extreme cold, very extreme hot. Physical fatigue, sometimes leads to person not moving from the cold condition. Immobility, if a person get unconscious in the any of due to another diseases also, then the person may not be able to move from that condition. High altitude or low oxygen tension, these are the various conditions, environmental condition that may expose person to the hypothermia, low temperature. Pathobiology, we can see that how the hypothermia happens and how the body reacts to that. Severe and prolonged hypothermia is called to leads to multi-system derangement, lead to decreased oxygenation in a very simple way, but it has a very long pathophysiology. But for the course which we have designed, I have designed basically for making up the injury reports, and I have designed this course for the medical officers who are already doing the who are preparing the injury reports, and they should know how the injuries happen or what are the injuries that are common in our places, and how we will be evaluating these injuries, how we will be preparing the injury reports and try to minimize the errors in the injury report. So we should be we will be focusing on this aspect only in this course, so that our general practitioner who are subjected to prepare the injury reports in our setups, like in district hospitals, community centers, or the primary health centers, so that which is the raw data which we are going to prepare of the injury reports, which myself is facing very problematic condition, that there are a lot of errors in the primary injury report. So we should be getting that and get the people corrected at that moment only, so that less and less burden to the police, less and less burden to the judiciary in the poor performance of the injury report. So we will be trying to, in the coming lectures, we will be dealing with the how to make injury report, how to examine it, how to examine the X-ray, and how to examine the other CT reports for the injuries, and what are the different legal aspects, what are the different case scenarios we will be discussing. So we have a lot of coming up things which are very important coming up in few lectures coming. So we should be very much aware. The main difference, again, cold stress is our behavior, how we behave. Second line, automatic thermoregulation mounted by hypothalamus, heat conservation, production of heat, and further mechanism is vasoconstriction, shivering, that is another phenomena. Shivering means muscle contraction, lead to increased production of heat, increase in metabolic activities like thyroid and sensorineural systems. Horripilation in very remote area, remote cold condition is a very horripilation is increased covering of the body with hairs. So generally it is not in our country, but in cold countries the person may develop more hair for the protection from the heat. One of the photographs is here, horripilation, which is lot of heat, but it may be a genetic condition also, in which there is a increased production of hair all over the body.